We're good. Okay. Hi, everybody. We are so sorry for the delay here. We had some technical difficulties and had some trouble streaming to Facebook, but we wanted to make sure we were clean and clear and ready to go. So thank you for your patience and apologies for that. And I am Erin Morgan. I am the editor-in-chief of Eye Care Business Magazine, and we are really excited to be here today with these amazing panelists and to kind of explore what's happening in our industry, in the practice of optometry, and also take a look at specifically how we're looking at reopening. What are some of the strategies and ideas and insights there from our panelists on when the time is right. What are we going to be doing? What are we looking at? What are the different protocols that we'll be kind of putting in place for reopening? So this is our weekly live stream series. We're running in April, and we're likely to extend it into May because we've had such a fantastic response to it. So thank you all for joining us every week. And it's called the Eye Care Business COVID-19 Strategy Series. And the focus is really to bring panel discussions and interviews with experts to really help our readers, opticians and optometrists, navigate this super challenging time. It's something none of us have ever dealt with before. So we're really just trying to kind of pull together as much knowledge base and information as we can for everyone to kind of help along the way. So I'll just introduce our panelists, and then I'll share a little bit of our new research from Eye Care Business. We have a new COVID-19 and ECPs study, wave number 2, that just came out that has some really telling statistics in it. I'll share a couple of those real quickly, and then we'll get into our Q&A with our panelists. Please keep in mind that we will have a Q&A with our audience. We had fantastic questions the last 2 panel series that we've run. So feel free to type your questions in as we go. If you do have questions, feel free just to kind of type those into the comment bar there in Facebook or on YouTube, and they will pop up for us here, and we'll be able to see them and answer them at the end. So that'll kind of happen the last 15 minutes of the panel discussion. So our panelists here today, I'm really thrilled to welcome Lena Walker, an optometrist from the Portland area. Also, Jim Mulligan, who is an owner of an optical shop in Pennsylvania. And I'll let Jim go ahead and pronounce the name of that for me. It's a more complicated name.
So my first partner, his name was Jim Bouquet, just like a bouquet of flowers. So it was Bouquet Mulligan, and then Dr. DeMeo. So it's Bouquet Mulligan DeMeo, eye professionals.
Oh, nice. Okay, yeah. Thank you for that. Well, that wasn't too difficult. Bouquet Mulligan DeMeo.
Right.
And you guys have one location there in Cleo.
Actually, we have 2 locations, and we also have a satellite location in a Masonic Village nursing home.
Oh, that's fantastic. I didn't know that. That's great. Is that newer, that new satellite?
No, we've had that since '99, but lately it got bigger, and now we actually have 2 exam lanes in there and a small optical in there too.
Wow, that's fantastic.
Yeah.
And Jen Lyerly, she is also an optometrist, and she's in North Carolina. And thank you, all for joining us today. So I'll start with Lena. Lena, can you just tell us briefly, you have 2 practices that you run, and they're both outside of Portland?
Yes, one is about 15 miles outside of Portland, and the other one is another 8 or 9 miles past that. So
okay,
yeah, 2 practices that have been out there for many generations now, and I got to take them over. So
oh, that's fantastic. And when did you take those over?
I bought out my previous business partner completely about 5 years ago, but I've been at the practice for 20 years now.
Wow,
yes.
That's amazing. Fantastic. And so, Jim, your 2 locations, what are the towns that they're in besides the satellite?
So we're in a little town. We're in a little town called Cleona, Pennsylvania, which is real close to Hershey, PA. And I actually live in Hershey. That's where I am right now. And the other location is in another little college town in Lancaster County called Elizabethtown. And
nice.
That's where the 2 locations are.
Fantastic. Beautiful spots. I grew up in just nearby there. and my folks still live there, so I know that area well. Yes, and so you guys have a focus on, I mean, you're obviously a full service, optical with an optometrist on staff. Is that correct?
Yeah,
And
we have,
you have
5. We have 1 ophthalmologist, Dr. DeMeo, and then we have
Okay.
4 full-time optometrists.
Oh, that's fantastic. Okay, great. And how long have you been running those businesses?
Since 1985.
Wow, long time. So, and Lena, just to go back to you, so, is it just yourself giving exams, or do you have other optometrists?
There's a husband and wife that work with me as well. So 1 full-time and 1 part-time. And,
Okay.
yeah, and about a dozen staff members that work with us.
Okay, fantastic. And Jim, I'm sure you guys have a bunch of staff members, and you also have a big focus on sports eyewear at your businesses as well.
Yes. So we actually have 35, 36 employees.
Okay, fantastic. Big place.
Yeah.
Big operation.
Yeah.
Yeah. So, and Jen, you have been an OD. What's the name of the practice that you have been with in North Carolina?
So I'm at True Vision. My partner, Dr. Alicia Barnes, founded the practice about 5 years ago. And then this past fall, she opened up a second location in Raleigh. So we're a 2-doctor, 2-practice entity.
That's great. And you also work with Defocus Media, and you have a blog. Can you tell us just a little bit about those as well?
Yeah, so in my spare time, I'm a partner on Defocus Media with Dr. Daryl Glover, and we have a really popular podcast and do a lot of social media and live events like this, which we love doing. And then I also write for Idolatry blog, though I will say, since I had a baby, I've not been blogging quite as much as I used to. I'm going to get back into it one day, though.
Jen has an 11-month-old baby at home that just took her first steps, right?
Oh.
Yes. Yeah. So we've been really busy and wild over here at my house.
I can imagine. I know how that goes. Well, thank you all for joining us, and thank you for that background on your businesses. It's really impressive, amount of knowledge here. So I appreciate you joining us and sharing with our readers and our audience. So as I mentioned, today's panel will focus on strategies for reopening. We're kind of in the midst of all of this. We've covered in past panels kind of, where are we at? What are the coping strategies for right now? And then with last week, we had an economic outlook from a fantastic economist, Brian Bolio. And that was really telling, for what we're looking at for our industry for the future. And now we're kind of starting to talk about, okay, once we can and get there, what are some strategies for reopening? So before we get into our question lineup here for today, I just wanted to share really briefly, we have this fantastic survey we've been running, super telling. We ran the first wave of it about 4 weeks ago, 3 to 4 weeks ago, and it's the Eye Care Business COVID-19 and Eye Care Professionals survey, focus group survey. And we had, overwhelming response to the survey with the readers, and it goes out to our entire reader base. And so I'll just share a couple of these key stats with you. So the first one is, we asked folks, are you open? And of course, are you open? Are you closed? Most obviously are closed. We had, I think, one person say that they were still open, but that we're not really sure if anybody's open fully at this stage. But we had 72% of the responses tell us that they are open, yes, but seeing only emergency or critical care patients. And then no, 19% said totally closed, not even critical care. So it's just an interesting kind of stat to see where, some folks are at. We also asked about telemedicine and telehealth services as an option for patients. 40% said yes, we are, currently or planning to, currently offer that option for patients. That is up from 31% from our Wave 1 survey. This is our Wave 2 survey, which we just got the results in from the end of last week. So That's up 40% now from 31% saying, yes, we're doing telehealth or going to offer very shortly. 28% said no, and another 20% said still considering to do it. And then, big telling one, we asked, do you expect to experience a financial impact from your business due to COVID-19? Of course, this survey, the Wave 2 surveys, 85% said yes, expecting a significant impact. That is up from 79%. So it went from 79% to 85% from Wave 1 to Wave 2, saying significant impact. And then 12% said expecting some impact. Only one person said no, no impact. So, and then we asked about, has your office temporarily laid off or let go of staff members due to the crisis? And 56% have said yes. That is up from 38% in our Wave 1 survey. So we've grown in that number over time. 8% 3 weeks ago had laid off folks, and now it's 56%. 31% said no. 5% said considering or planning to do so in the future, and 8% said, don't know, too soon to tell. So those are kind of, some of our key stats. I think it really shows, where the mindset's at, what we're looking at, what we're faced with in this very moment. And so I'll head into our questions, our Q&A here for our panelists. And at first, we'll have a section where we're kind of going to look at the problem. Let's look at the problem. Where are you currently at with your own offices? And then we're going to look at innovative solutions for reopening. And we'll head into those questions next. So again, folks, as you're listening, if you think of the questions, feel free to type them in. I see we have a lot of viewers here with us, so feel free to tell us you're here, or feel free, as a couple of folks have already. I see Bev Heichman, who I know is here, and Kim Kingswell. Thank you both for joining us and for telling us that you're here. So feel free to tell us you're here. We'll give you guys a shout out, and then also feel free to start typing in your questions. So the first question for our panelists is your office currently closed or open in any manner? Obviously, one or both offices if you have more than one. And, or are you open for just urgent care, and why was this the best choice for your business? So maybe I'll just start here to my right or left. I'm not sure which way that is as we're looking at the gallery view here. Lena, where are you guys at? Are you totally closed, or are you open for some care?
So we closed one office altogether, the location that has a smaller footprint, and kept the office that has more physical room in it open 4 hours per day, Monday through Friday, but with the doors locked. And so we're just staffing it with an office manager, one doctor, and an optician. And we're still doing just emergency care only, and contact lens orders, glasses repairs, but the patients need to call us when they arrive, and we sanitize it between each and every one. And whenever possible, I'm doing telehealth visits remotely. That's great.
So are you able to do those from your home?
I can through one of the apps. We've always kept in touch with our patients via a text messaging app, and so they can send us photographs through that app. It's one of our patient engagement programs that we use at the office. It's been really handy right now.
That's great. What is the program that you use?
We use Weave.
Okay.
But for the video calls, we use, FaceTime or DoxyMe.
Yep. I've had a DoxyMe appointment with my own GP, and it was great. I mean, it was really, perfectly, great appointment. I think I'd like all my future appointments to be like that. At least, the ones where that it's just a question or, something more minor for sure.
But we felt we had to stay open because there aren't any other eye care providers out there, and we don't have a hospital. We have one urgent care, and I couldn't see how our patients would be able to access care when they needed to. I didn't want them to drive into Portland and try to go to hospital. So
No doubt. No. And that's, how far is that for them from your?
the closest one's about 15 miles.
Okay. Yeah. So not a lot, just to have, to put this taxing the system, there, you're saving all of those folks from having to deal with those more minor things. So that's great. So, and Jim, how about you folks? So with your 3 different locations, including the satellite, are you open for emergency care, or are you closed? Is your ophthalmologist on duty?
Yeah, so we are doing, we are seeing emergency patients, since we do have Dr. DeMayo. So we're seeing some emergency like repair work too. So we're kind of going in. We have a staff of 3 people on basically that are just canceling our schedule, because we're actually canceling over 2,500 appointments needed to be changed.
Mm-hmm.
So
that's a lot.
Yeah, it's a lot with all the practitioners. So we do see people by appointment, but it's got to be basically like an emergency.
Gotcha. Okay. And then Jen, what are you doing? What is your practice doing there?
We're very similar. We have 1 staff member at the locations. And again, if someone is coming to pick up glasses or do a repair, the doors are locked. They kind of call in and schedule to say that they're coming. So there's only 1 person there at a time.
Right.
And then trying to triage as much patient care as possible. Our staff member will answer the phone and then decide, okay, do they need to talk to the doctor with this issue? And we'll do either a telehealth exam, or if it is like, I've got flashes and floaters, okay, sure, we'll schedule you a time where we physically come into the office if that's necessary.
Sure. That's great. So, and, with all of this going on, and knowing the statistic that I read earlier about the financial impact, my next question was to you all, is that where you're at too? Is that a realistic view? I mean, 85% say they expect a significant impact to their bottom line, for this year, and our economist last week said, we're going to look at kind of, like this year is going to be tough, as things reopen. We actually, I don't know if you folks saw it, but yesterday there was some kind of somebody that had worked within the Obama administration got on the Today Show and talked about how optometrist offices are one of the first things that could open. Obviously, people aren't going to go to the movie theater, but if you can do kind of a 1 in, 1 out, cleaning, it's a profession where people can start going back in and getting exams that they need. But with this in mind, and our economist said 2021 for this industry will look a whole lot better, than 2020 for sure. And we might even see kind of a full recovery by, the end of 2021, to be determined, obviously. But what's your feeling? And, maybe I'll start with Jim this time on financial impact and recovery. What are you kind of projecting?
Well, this entire process, which is so foreign to me since we've never seen anything quite like this, but it's definitely going to make an economic impact in our practice. We're, looking forward to getting word from the governor that we can start, seeing routine vision again. So that's what we're waiting for. But it's tough. It's really a tough thing for us. And, we think that there's going to be, we're probably talking about maybe seeing, 3 patients an hour, and just making sure people don't bring other people with them. In other words, you come in by yourself unless you need assistance. So that's the kind of conversations we're having with our team right now. And yeah, it's going to be different with even trying on frames and everything else. So
that's a tough one.
It's going to be tough. Yeah. So
yeah. So when you
we're
think
hanging in there.
Well, that's good to hear. And it seems like, once we kind of, business may not be as robust as it was, because of those new protocols that have to be in place and fewer patients per hour, things like that. So it may take a while, to get to recovery. So Jen, what are you thinking? What's your practice thinking on that front as well, on the financial front?
Yeah, I mean, I think the impact is going to be very, very large to us. We saw an impact as early as the beginning of March, even before the offices closed, where people were, oh, well, I don't think we need to look at glasses today, not really spending money in our optical, even though they were still coming in for their exams, right? And long term, our patients are going to have some financial distress this year, where that second pair of glasses, or maybe thinking about a purchase of contact lenses, like, oh, maybe they'll just get what's covered by insurance, and a little bit more difficult to have these conversations where you're talking about out-of-pocket expenses. And that's not a solution that's going to be going away even after we open routine care back up.
Right. That's for sure. No question. And Lena, are you kind of in the same similar camp?
Oh, definitely.
With the financial impact?
If we're talking about being closed a total of 6 to 8 weeks by the time we get back, that's, 20% of the year. And in my case, I was all set, ready to pull the trigger actually on a office renovation for our smaller location, and that was gonna happen in June. So it's changed all of my future plans for that.
Yeah, I imagine, cost spending right now is like everybody, everybody's trying to kind of watch costs and keep pennies close to the hip for sure in this crazy moment. So, and then just, kind of bouncing off of that question, how has your office handled staffing decisions? Have you had to kind of furlough opticians or, different folks within the practice, and then also on that same note, has your business, I know a lot of businesses that we've been talking to, optometric practices and optical shops, are applying for that PPP loan through the CARES Act. So, where are each of you folks at with that? And maybe start with Jen, where are you at with kind of, has your office applied for the PPP? Have you had to lay off folks? What's the thought process there?
So the overwhelming majority of our staff is laid off, other than the 2 employees we've kept to kind of be there day to day in the office.
Right.
I myself actually am laid off. So we're all currently filed for unemployment and going that approach. And then we filed for the EIDL loan, the $10,000 loan, the PPP loan. So hopefully, as we see those kind of numbers coming back through, PPP, it does look like it's going to probably take some time to get organized and to actually see the impact. So it's hard to plan for it when you don't know how far away you are from seeing that money.
It does. I've talked to a lot of optometrists who've been applying for that, and it seems like the application process is, lengthy, and there's a lot of documentation required. And then in addition, you don't know how long it'll take to actually see any of that money. So, and I'm sure, obviously once things start going again and get back to normal, we'll start seeing employees come back and folks that were furloughed, kind of moving back into their positions, because obviously we're gonna need that for sure. So Lena, how about you? Have you guys had to kind of, how have you handled staff decisions?
So we furloughed about 3 people and kept the other 4 on, and applied, just like what Jen said, we applied for the EIDL and PPP, but haven't heard back about either. The local bank that I've done business with for a long time now, I think received 5,000 PPP applications on day 1.
Wow.
And so I don't know where I am on that list, but but they do a ton of healthcare loans to optometry and dentistry, and so we're all in that same boat, especially here in Oregon, where the governor dictated that the dentists can't go back until June 15th.
Oh wow!
Whoa!
So luckily, she didn't include optometry in that lump. We have, our association and board gave us more leeway to decide, but the dentists, my friends who are dentists, are having to wait a lot longer.
That's crazy. Are they able to be open for urgent care?
Yes, for urgent care,
Okay.
but the governor dictated that they they should donate all of their PPE to the frontline providers.
Wow. Right. Because they won't be needing it at least till that time.
But as far as my staff goes, it's terribly frustrating for them. A few of them have been denied, even though they shouldn't have been denied their unemployment benefits, and they've tried literally 500 times to call into the unemployment system, but haven't been able to talk to anyone. So it's really causing some distress on my end, being their boss and still feeling like they're part of my team and my family.
Right. I'm sure. Jen, have you been experiencing that same issue with applying for unemployment? I know you mentioned you had applied or were working on that.
I feel so lucky because after 9 days after I applied, I got paid. So
wow.
I've had a smooth process, but in North Carolina, at least, you do not have to call in and talk to anyone as part of the thing. You just have to use the online website. And yeah, it crashes like every 5 seconds, but it does eventually go through. But I know some states require you to complete the application with a phone call, and they just don't have enough people to answer all the calls.
That's crazy. Well, I'm glad to hear you got that all set up. That's great. Great news. So, and Jim, how you guys have a lot of employees. So what's the status for you?
Yeah, so our plan was to immediately furlough 34 employees in order for them to get the applications in as soon as possible. And they're reporting back to me. So what I do now is I try to call 2 employees a day and just reach out to them.
That's awesome.
Say, how you doing? This is what we're doing. How's it going? And then my employees actually started their own Facebook staff group. So I'm not in it, but everybody almost
right.
So they talk to themselves throughout the day on their own staffing Facebook site, which is kind of nice because everybody knows what's going on now.
Totally, and they can support each other.
Yeah. And so I call people every day and reach out to them. And I am hearing that a number of them are getting the unemployment checks. And then one of my employees that I talked to yesterday, a key employee, said that she also got the $600.
Okay.
Oh, wow.
Good.
Of her unemployment wage. So that's
great.
Yeah. So.
Okay. Well, that's good.
And then we did apply for every loan we could because we have I have an accountant and an office manager who handled all that. That was good to have that. So
that's great.
They got on that right away. So and I believe I heard that a check did come in, but I'm not certain of what the amount is yet.
Oh, that's great. So already like the loan application had gone through.
Yep.
And hopefully, potentially been realized. So that's fantastic.
Yeah.
So I'm going to head into our section on kind of looking at solutions and looking at reopening, but I'm just going to mention here, because we have a whole bunch of comments from folks. We have our wonderful publisher of Eye Care Business, Mark Durick, is tuned in. Hi, Mark. Thanks for joining us. We have Felix Marks from Colors in Optics tuned in. Thanks for joining us, Felix. And we have Buddy Smith from Denver. Hi, Buddy. I am down in Durango right here, sitting here in Durango. So nice to see a fellow Coloradan. And then I have a couple of questions, too, that we'll definitely get to. We have one from Candace Macri talking about PPE, so we'll address that later. And then thank you to Donna Anderson. She mentioned it was the governor of Wisconsin who was on the Today Show. So thanks for that info. And then we have Karen Mashaw D from Maine. Buddy Smith is here. Okay. And then Mark Durick has a question. So that's great. So we'll get back to the questions afterwards, back in our Q&A section. So looking at each of your businesses, and looking at what's going on in your own specific state. So we've got Pennsylvania, North Carolina, Oregon. When do you anticipate it'll be safe and allowed for practices and optical? I mean, I know it's like the $4 million question, right? So When will it be safe and allowed for practices and optical shops to reopen? And then we'll get into kind of the best strategy stuff. But, are you hearing anything? Like, what's your kind of best guess for each of you? So, and maybe we'll go ahead and start with Jen. Have you guys heard anything there? Our
shelter-in-place order for North Carolina expires on April 30th. At the same time, there was a 3 days ago, a publication from one of our major health systems, Duke Health System, saying they expect hospitalizations to peak May 2nd. So there may be a delay with that April 30th date.
Definitely. I mean, we're seeing the same here in Colorado. They were pretty assertive with getting it in place right away, and it's been extended through the end of the month, same as you, April 30th. And it looks like, it seems that that's going to be further extended. So it's anybody's guess, right, at this stage, when it'll happen. So, and Lena, how about you? Are you hearing anything up there? You guys kind of got hit with all of this first.
Well, I think in Washington they did, but the Oregon governor shut everything down pretty early. And so the infection rates and the death numbers are actually pretty low in Oregon. I think about 55 people in total passed away the last time I checked. But I have been stalking the Oregon Health Authority website every day to check the numbers, and particularly to check the numbers in the area where I practice, where there are hardly any people reported to be infected and no deaths, which is great. But I surely don't want to start to be the vector by which people get infected. And so I've been talking with my colleagues, and we formed our own Oregon Facebook group for the ODs, and everyone kind of thinks that we'll get to open the early part of May, which would be great.
Yes, that would be great.
It would be great.
Jim, I know Pennsylvania was kind of pretty hard hit, and especially getting closer to Philly.
Yeah.
Where are you guys at?
At the end of March, we were talking about possibly early May. But I'm not sure about that now. So in Pennsylvania, we're just taking it day by day. The Surgeon General comes on and has a meeting every day at 2:30 and goes over the numbers. But we're hoping for possibly, early May. But I think that's a little optimistic now.
Right. I know it does, but so it's kind of, we're in this holding pattern here, right? Where it's a great time for folks to kind of at least be planning, for how are we, if, when we can, maybe it's a month, maybe it's a month and a half, it's anybody's guess. But when we are in this process of planning, kind of what are our new protocols and what are our strategies for reopening, what are some of the ideas that each of you are working up? I listed on my question, just some thoughts like limited hours. I know, everybody's doing that currently with emergency care, but like a one patient at a time policy. I know, Jim, you mentioned 3, for a bigger office, PPE for staff, rigorous cleaning protocols. How are you going to clean frames? Like I've had folks tell me, oh, we're going to just, what we'll do is not have folks go up to the frame board. We'll bring a selection of frames, to people as they're sitting at the dispensing table. I mean, that's a whole different experience. A lot of folks want to go and look at everything, or maybe the optician pulls it off the board, for what they want to try on, cleans everything, and then cleans it again. So, I've been hearing a lot of different things for ideas. Maybe start with you guys, Jim. What are you thinking best strategies to approach, reopening? I know you have a lot of different layers going on, and even with your satellite office.
Yeah. So we're not seeing anybody in the satellite office right now. But yeah, it's going to be, everybody is going to be super, highly focused on this distancing issue,
Definitely.
So we're gonna have to keep that. That's going to be our number one priority. I just ordered like 200 some masks so that all the employees have a mask available to them.
That's great. Where did you find them? Everybody wants to know.
Yeah, the guy that does my embroidering shut his embroidering
Yes.
business down, and he's making masks.
Wow.
Yep.
That's fantastic.
And so I called him a couple days ago because they had a little blurb about it in one of the newspapers. And
Sure.
I called him and he said, I can't do it. And I said, I've been doing business with you for 30 years. I sit next to you at the Hershey Bears games. He's like, when do you want them?
You got to pull in all the favors at this stage.
Yeah. But yeah, that's kind of what we're gonna do, and you know,
That's great.
just you know, really be careful with the frame. That's gonna be a talking point. You know, how do people try on frames, and how do you keep that safe, and how do you disinfect them? You know, we do have that thing in the office called the Optic Wash, which disinfects.
Oh.
You ever see one of those?
No. How does it work?
Oh, it's pretty cool. You guys saw it. I know Lena's seen it. Yeah, it's just a kiosk, and you put the glasses in. It's like a car wash for glasses. But the water is purely disinfectant, sterilized water.
Wow.
And
These guys are going to have business through the roof.
Yeah, so we're thinking about, you know, utilizing that. But yeah, it's going to be a whole new vibe in the optical. Like, you know, like I had trunk shows scheduled where people pour it. You know, that's done.
For sure. I know it's a big question, and it also becomes, you know, and I didn't have this question on the list, and I'll throw it out there we'll cover it later, you know, maybe at the end in the Q&A, but, you know, just to think about, you know, what do you guys think about buying frame, you know, like looking at product? Are you going to go to a trade show? Are you going to, you know, visit with reps, or would you rather do stuff online, you know, at this stage? So I think that's another question I know folks are contemplating too, for sure.
Yeah.
So yeah, it's a big question. So Jen, what are you guys thinking, you know, for when you do get to the point of reopening, strategies for handling all of these things, trying on frames, scheduling patients?
Yeah, I mean, we're definitely going to be limiting the number of patients in the office. We foresee when offices reopen, we'll have that cap of no gatherings of greater than 10 people that we saw in place about a week before things went fully shut down here in North Carolina. So making it where, you know, we don't schedule more than every 20 minutes, maybe even every 30 minutes on an exam, maximum one guest per patient. Which can really make things difficult when you're talking about scheduling families or children or things of that nature for parents. And then PPE is probably the biggest concern, because we have like 30 masks total in our office with no hope of getting more. So we're actually just ordered cloth masks for everyone from Alice and Olivia. So they're really cute. I know they're not as safe as the masks that we'd want to have, but if we're faced with nothing versus a cloth mask, I think that's the way forward, at least for us. So all of our staff will have at least a cloth mask until we can get something else. And then questions of, are we going to have patients required to wear masks? Like some grocery stores are requiring people that enter wear masks. Temperature checks when everybody comes in, I think we'll still have that in place. We were doing that before we closed as well. And then on the frame side of things, I kind of picture really limiting, like having minimal space on the frame board utilized, and doing most everything with trays, where someone, you know, comes in and we can see like, oh, this is their relative size. This is the tray of things we have that are in your size, or kind of pre-scope some things out for patients. Especially if we're seeing a limited number of patients, we can select frames when they walk in and have them ready for them when I walk them out. So there's very little frame board interaction.
That's a great idea for sure, because that's like, once you open everybody up to the frame board, that's, you know, really tough to manage disinfection for sure. Do you think that, you know, obviously with the proximity of the exam, you know, and I was thinking this about the dentist as well, you know, I mean, you're obviously dentist, they're in your mouth, but, you know, with an eye exam, it's really up close and you know, really front and center with the patient face to face. You know, do you think that you would consider to have the patient wear a mask during the eye exam, and then the, you know, optometrist or ophthalmologist has one, the proper medical mask versus a cloth mask? I mean, do you think that's a protocol we'll see? Anybody?
Personally, I feel like that would be the best way to do it, because we know, I mean, I've been coughed on, sneezed on in the slit lamp, like there's a lot of breath that happens there. So both of us being covered is probably best.
Yeah.
Yes, for sure.
Yeah, I noticed when I was doing exams earlier this week on patients that came in, we have some regular surgical masks, but we ask them to wear their own masks whenever they have them. But one of my patients came in wearing one of the hard shell kind of N95 masks, and as soon as she sat in the slit lamp, the whole thing went up. So then I couldn't actually examine her eye because the mask was working on her eye. So then I had to ask one of my staff members to get a surgical mask and switch it out, and it was
these are the learning points that everybody's going to have to do, like which mask works the best and
you can't see their facial expression, and they can't see mine, so it's a whole different way of communicating with words, where you have to be a lot clearer when you don't have all of the other cues that we would normally get from people.
Totally. It's so true. And, another question, and, Lena, I'll also ask you kind of what are your ideas for best strategies to approach reopening, but, would you wear, I see a lot of folks wearing protective goggles too, or eyewear, I've been told, shouldn't leave the house without it. I mean, wraparound sunglasses, 100%. So, because it, obviously can get in your eye too. So what do you think about that for the exam?
Yeah, I mean, I normally wear my glasses when I'm examining patients anyway, so I think that'll help. I did purchase some safety goggles and things for the other doctors and the staff who would like to wear them. But I was also thinking about my hair, because my hair is quite long. And so I was even thinking about wearing one of those surgical caps to keep,
it back,
keep it back and out of the way. But I don't want to, it's all of those things that, we'll have to consider.
It's a whole new world.
Before.
Yeah. Oh, I know. It's crazy to think about all of it. So in terms of the reopening process, would you think about similar, like kind of less patients in at once, the frame board, all of those similar things?
Definitely agree with all of that. And even before we closed, we were sanitizing every single frame that a patient touched. So we gave them a tray, and they would put everything that they touched into that tray. And one staff member would then clean them with a Clorox wipe afterward. But one of my associate docs had a great suggestion where we would schedule things that don't require as many staff early in the morning and late in the evening, where it could just be the doctor and the patient. So contact lens.
That's a great idea.
Follow-ups, even some of the diabetic exams, cataract post-ops. We can schedule that so that the staff can go home and they don't need to be there with us, and that's less people in the office.
Yes, and for sure.
People based on their age group as well and their needs.
That's a great input. And it was actually one of our viewers, I think it might have actually even been Mark, asked a little earlier, with all of the layoffs and the furloughs and that has been staff, primarily opticians and staff, but also optometrists as well. But do you think that more of the optometrists will be doing kind of that, soup to nuts we've written stories on that where it's kind of considered concierge eye care. The patient comes in, they only deal with the optometrist. They're, even the fitting is with the optometrist and the frame selection. Do you think that's possible that, and like you said, that might be a morning and an evening thing, whereas the middle of the day, is more staff, stacked with staff. So what do you think, Lena? Do you think that that's possible? We'll see just fewer staff in the future and more ODs doing more of everything, or?
It's possible, but I personally don't have the knowledge base in the optical area that my staff.
Right.
I very
And
much.
they're really experts.
I know. I appreciate our professional opticians who are very well educated in that field, and
No doubt.
I don't envision a day where I wouldn't have them.
Yeah, no doubt. What do you think, Jen? Kind of similar? That's an essential.
I view the optical staff that we have like as my partner in everything that I do. And we're of equal importance to the patients and satisfaction, right? At the same time, though, I do think the patient would feel better if they came in and didn't interact with a whole bunch of people, right? We've been social distancing for so long now. I think being in anything that feels like a crowd is going to make people uncomfortable and
Very
less
much
likely
so.
to want to hang around and look at eyewear or purchase anything in your office. The con of this, though, is the way, if you accept insurance in your office, the way plans are set up, if you're talking about going down to seeing 1 or 2 patients an hour, it will be extremely difficult to produce the revenue that you're used to producing, right?
Right.
So if that's the long-term model, the current insurance model really won't support it.
For sure, because that was seeing a lot of patients, so there's got to be a whole new protocol put in place, at least for the time being, until, there's more immunity out there, whether that's through a vaccine or, other methods. But yes. So, and Jim, and just kind of dovetail onto this, which was, one of my last questions, handling staff decisions as you, what are you thinking about as you bring folks back in, and then also, will people have to do more? We're all doing more and kind of working, multitasking now in this crisis. Will that have to continue? And training staff on handling the new protocols, I think, is a real big, key issue to address, for sure, as we all move back into operating.
So, our thoughts are going to be, this isn't just, somebody flicking a switch and everything goes on again, obviously. So we're going to be bringing in, key people, just kind of bleeding in people and, starting to ramp up. But once again, the key thing with this is we don't want to jump in too early and have another spike with this problem.
Sure.
I mean, that's the thing that has everybody the most nervous. So we want to, be cautious on that. And yes, absolutely training the staff on what our new protocols are. And that's very important. So the one thing I wanted to say to Lena and Jen is thank you for appreciating the opticians. Appreciate that. And I wanted to throw out, we ordered acrylic pieces to attach to the slit lamp. Have you seen those from Zeiss?
Mm-hmm. Yeah.
Yeah. So there's an
acrylic
thing that, that is, so when you're getting in close, it kind of blocks that patient. So
that's great.
Get some protection. They're sending only two at a time of the shield.
Right. I'm sure they're being overwhelmed with that for sure.
Has them.
That's great.
We made some bigger ones for our slit lamps, bigger than what we used to have. And I noticed that with my little T-Rex arms, it was hard to get around.
Yeah, too wide.
Legs and take out
gonioscopy with like a shield.
My arms are so short, but
it's tough. We're going to need adjustable shields, for you folks, for sure. Oh my gosh. So, you folks have answered a lot of the questions. I know we're kind of, we still have a lot of viewers here, and I want to get into their questions and comments too a bit, but I just want to ask you folks a couple of last super quick questions. I know you've talked about, one of the questions was, implement screenings, are you going to ask folks on the phone? Like my daughter had an appointment. She has a front tooth that was damaged, and she had to potentially get a root canal. It was, we're hoping not, but for her appointment with the endodontist, they, asked me a ton of questions. Where have you been? Where have you traveled to? What have you, been exposed to? Do you have a fever? all this kind of stuff. Do you think that, we'll see your businesses doing something similar, screening patients before they come in? I know you mentioned, I think it was Jen, temperature checks, when you get there, but, people can have no symptom. They can be asymptomatic. So who the heck knows, right? Yeah. So, Jim, what do you think? Do you think we'll see any additional screenings?
We're having a meeting coming up next week, and that's on the agenda of how we want to do this and how we want to train the staff, because like I said, we have a lot of people. So, but yes, I definitely think there's going to be, in other words, the way we started was very, we don't want to be too aggressive, and I know Lena feels that too. But originally we just put signs on the door, big signs as they entered into the foyer, saying, if you don't feel well, reschedule your appointment, stuff like that we're just, letting people know that we are concerned about this. So, so yeah, and we were touchy on the temperature checks. Like, I don't know how Jen, did that go well with the patients?
Everybody really seemed to. Now, we didn't start it like super early on, right? This was more just when some of the rules about limiting exposures, and basically it became CDC guidelines. I've heard from other optometrists that were implementing it maybe a week earlier than that they did get patient pushback. But when we started doing it, patients were like, "Oh yes, please. I checked it before I came, but I want you to check it again." Right. So we were just doing a forehead check, which I know is not super accurate, but minimally invasive.
Yeah.
Right.
I think that'll be on the table for us too. Yeah.
What do you think, Lena? Similar? And do you think that we'll see any kind of, phone call screening when you do the check-in for the patient, or asking questions?
My staff's already doing that now, but I was even thinking about installing a Ring camera, and I bought one, but haven't figured out how I want to mount it so it doesn't get stolen. But you can't even find regular intercoms anymore. So I thought if I installed a Ring camera, the patient could press it, and then the staff member using the Ring app on a phone that we keep at the office could talk to the patient before they even enter the office to screen them.
That's great.
Because some people might not have their cell phone with them.
Right. Very good point. For sure.
And you'll be able to see your face through the video as well.
Yes. Well, this all kind of, answers a question of, what's our future here of eye care and eyewear looking like, with protocols and changes and checks and masks and, things like that. And it's going to be everywhere, right? I mean, wherever we go, you go to the restaurant, you go to the supermarket, it's just a whole new normal, is going to be self-evident. But, the last question I'll ask for you, and then I'll just kind of read some of our comments and quick questions, as everybody's waiting patiently here. Do you have any comments on that question of, what's the future going to look like? But then my last question was, what's your best advice for your peers right now? I know I've seen studies, showing the stress level is super high. People are looking for as much information as they can get, and kind of just, support. So what would you say is kind of your best advice? And maybe I'll start with you, Lena.
I think that a lot of people are out there saying that eyewear and eye care is going to go online, but based on what I'm seeing with my patients and my interactions with them in the last few weeks, I really don't think we'll ever lose the appreciation for that human, face-to-face interaction. And as long as you keep your positive energy and connection with your patient somehow, I don't think that'll ever go by the wayside. And if you can express that you truly care about them and their well-being by taking all of these steps to, implement these protocols, I think it'll go a long way with them. And as far as trying to get through these times and advice for our peers, I think we just have to focus on being a leader at our practices, making sure that our decisions are decisive and that our staff have confidence in what we're doing, and that we keep them involved, but yet somehow keep things a little bit fun and lively at times by having group discussions and team meetings, still celebrating birthdays and things that we would normally celebrate, keep some sort of normalcy with them and give them something to look forward to, like your annual Christmas party, or, give them something to be proud of when they think about their place of work. So.
It's a great advice. So, and Jen, how about you? What's kind of your best advice in this given moment?
Yeah,
peers?
I mean, I think I love what Lena's saying. Optometrists, we actually have this great opportunity. If we haven't been happy in our practice, how do we redefine and make, instead of chasing monetary success, right? Chasing a fulfilling and happy workplace. And now, after 2007 crash, I feel like I've lived through 2 financial crashes, right, at this point. And it kind of just goes to show you, like, you can't count on the money. The only thing that you can really count on is friends, family, living a happy and fulfilled life. So I think many optometrists are going to reevaluate how stressful their day-to-day patient care has been. Has it been all that rewarding to chase small revenue sources, and maybe kind of scale things back, do something a little bit smaller, a little bit more personalized, and find that fulfillment, as well as financial success, but something that's really wholesomely fulfilling to your person.
It's a very good, very, very good point. And I think that's great advice. And I think a lot of us are reassessing, right? Just like what's important, now, and having lived through this, for sure, puts it in very stark perspective. Yeah. So thanks for that. And Jim, how about you? Kind of what's your advice from your vantage point?
Well, I think the eye care business has been great for all of us so far. I think that the patients realize they have one set of eyes, and they want to take care of them the best they can. So I feel really connected with Lena and Jen about their strategies, but I think we're gonna be able to get through this, and I think everybody's just gonna, basically hang tough. And I think once things kind of get going, I think we're going to be doing better than ever.
That's great. Well, and our economist kind of echoed that sentiment. He said kind of full recovery is what they're anticipating, and he was a U.S. economist, and he projects for a lot of big companies. So I'm going with that. Yeah. Going with that good vibe.
Yeah.
Well, thank you all for that. And thank you so much for your feedback. I'm going to just really quickly read our comments and a couple of quick questions that we have. I'll just mention we have Amber White here. Welcome, Amber. Buddy from Denver said, we've been told April 30th, but likely to be extended. All non-emergent departments on furlough at their business. And then Revolution Macri, I'm in PA. I think Wolf is going to extend it too. And then we have someone from Nigeria joining us today. And I am so sorry if I don't say your name correctly. Ojeki Nwakiti. Thanks for sharing your experiences. This is Ojeki Nakwiti from Lagos, Nigeria, resetting the way we practice now. Thanks for joining us from all the way across the world today. And it just goes to show this problem is global, 100%. So we have also Joe Green here, Lisa Beam. Mark Durek asks a question. Do you prefer online communication now from your vendors? And this was a question, I had mentioned before, what's your thought here with trade shows and vendors, and how do you want to see product now? Are we going to be looking at frame collections with masks on? What's the future to show products and services? How do you guys want to see that stuff? So maybe start with Jim.
Well, so I'm old school, and I got to feel it. And I gotta examine the hinges and examine how can I shorten the temples? Can I, how's the adjustment going to work? How deep is the eye wire of the frame? So I feel that I'll still see, carefully see my vendors, Now, does that mean I might limit a couple of some of my vendors? In other words, like take it from 25 to 18 or 19 now? I mean, I think I might do that because there's some people that I just, don't need to see. Okay.
Sure.
I can reorder over the phone, more or less.
Sure.
But I still think I will want to look at it and touch it and, examine the product before we bring it in.
Right. That's great. That's great to hear. And I think there is, it's such a quality construction, are so critical in eyewear that you want to be able to see and feel and touch it. What do you think about going, trade shows at this point? It's hard, it's anybody's guess, right? When we get there, maybe it's months off, maybe it's, more. It's hard to know. I think everybody's just kind of wait and see. But what are you thinking, Jim?
Well, I'm thinking I'd like to get together with all you guys in Vegas and go out to dinner. That's what I'm thinking.
I love it. Okay, we're there.
Yeah, no, it's going to affect it. It's definitely going to affect because the trade show is a big deal and there's a lot of people there. But hopefully, we can bring that back because I love the trade shows.
It's great, and the family of the industry, and we want to be able to have that again for sure, no doubt.
Yeah.
So, and either Jen or Lena, do you guys have any comments on that question of like how will you prefer to see, your vendors moving forward?
I think it's still important to actually see everything in person, even if they send a preview via email, because as we all know, you can't really tell what the colors look like until you see them up close and personal.
Good point.
Photos can be manipulated, and even the shape of things can be deceiving in a photograph. So
definitely, yes. Same, Jen. You feel like you want to see it, touch it, feel it.
Well, I think there's a reason that one of our largest online glasses retailers in Warby Parker has brick and mortar stores. Right. Our patients want to see and feel and touch it too, right? Absolutely. So definitely, if we're curating the selection of eyewear, that's going to be essential to how we do it.
Very good point. It's critical. So, and we also have here Carolyn Orms joining us. Thank you for joining us. Chris Browning said he appreciates the comments from Jim that he's really enjoyed hearing. And Courtney Chavez is here. Debbie Maffei, says, protect your staff, take clients' temperatures prior to office admittance. And then we also have, let's see, Dave Brown from Houston, hoping for a start time around the 1st or 2nd week of May. Bev Heichman says, we are hoping for the beginning of May. However, we think it's more realistic that the return date is June 1st. Megan Martinez says, what are your thoughts on seeing frame reps, which we just covered? Other vendors who traditionally pre-COVID drop in. So probably you want to schedule appointments, I imagine, at this stage. No drop-in vendors. Would you guys agree? Yeah.
Yeah, that's my rule anyway, really. I mean,
is it? Yeah, that's a good rule to have for sure. Tiffany Chan, hi from California. What are your cleaning protocols in the exam room or in the pre-test room? Anybody want to take that one?
Cleaning like a madwoman. I mean, we wipe down everything that could have possibly been touched, including the door handles. So we follow the patient everywhere and see what they touched. Usually with Clorox wipes. We have hand sanitizer everywhere.
Yes. So are you wiping the exam equipment with the Clorox wipes? Is that kind of the protocol? Yes.
Yeah. For now, while we have them.
Right. I know. Very good point. Because, I had bought a bunch before, and I have a 10-year-old daughter, so I kind of run around behind her and wipe everything down. Same as the patients. So thanks for that. So, and we have Revolution Macri. It's easy to say not to worry about money when you have additional income from your family, but it is, we're definitely seeing a lot of folks who are single income families that are having really real hardships. So I appreciate that comment, and that is 100% the truth. And Brian Schuller says, thank you, Erin and panel, another outstanding job. Sheena Taff, who is on our first panel, says she's here. She says you have to touch frames to really know. So that's for sure. Thanks for that comment, Sheena. And then we have Kelly Klusterman Bellevue, the sizes as well, I guess, for the frames and looking at those. Sheena says hi. Another comment. And then Alyssa O'Neill is here. She's a frame vendor and hoping to show frames via Zoom.
One of ours.
Oh, yay. And she wants to show frames via Zoom until maybe September when we get a new release. Is that acceptable? So what do you guys think about frames via Zoom until things kind of calm down? Anybody? Jim's not sure. What do you think, Lena, since it's your frame person?
Oh, no, we know her very well. I think that's fine, but at some point it would be, maybe there could be a system where at least some of the collection gets mailed to the office and perhaps returned somehow so the opticians can still feel the items.
Yes. Digital is just won't ever quite be the same, right? Is what I'm getting.
Right.
Yeah. That's great.
Yeah,
all right. Well,
I can see a rep saying, here's 7 or 10 new styles and sending them to us, and then we go with the colors later or something like that.
That's a great idea, because at least you get a feel for the product of the collection and the colors, and then maybe you don't see the entire collection, but you get to see and touch and feel some of it. That's great. And we have Janine Ava just jumped in. She says, "Hi, Jim. Thank you all for offering great advice during this time." So we had a lot of great feedback, and we keep getting comments. So you folks, we can feel free to keep coming into our Facebook page. The comments can keep coming onto there. You could check out all the comments on there as well. You can replay the live stream. This will also live on our YouTube channel, Eye Care Business YouTube channel. It's also living on our homepage, eyecarebusiness.com. And if anybody would like more information, feel free to leave a comment. We will be back every Wednesday at 12:30 Eastern Time with more panels and interviews and information for our readers and for our audience. And we so appreciate everybody joining us. And I cannot thank our panelists enough. You folks have had fantastic information, and what a knowledge base here. So thank you all for joining us. I really appreciate it.
Thank you, Erin.
Yeah.
Thank you, Jim.
Good luck with everything, everybody, and we'll see you soon.
Yeah.
Yep. See ya.
Bye.
Bye.